Page 98. Antepartum care. Care of a pregnant woman during the time of the maternity cycle that begins with conception and ends with the onset of labor. A medical, surgical, gynecologic, obstetric, social, and family history is taken with particular emphasis on the discovery of familial or transmittable diseases. A physical examination is performed, including observation and evaluation of all body systems and pelvic organs. The vaginal part of the pelvic examination may include estimation of the size of the pelvis, a papinocoleal pap smear, and tests for Neisseria, gonorrhea, Candida albicans, chlamydia, SPP, trichomoniasis vaginalis, syphilis, genital herpes, and other viral infections. Blood pressure, weight, urinalysis, primary for glucose and protein measurements of the height of the fundus and the osculation of the fetal heart are routinely performed at monthly intervals or even more frequently in the second and third trimesters. Laboratory tests are performed to determine blood type and Rh factor, rubella, antibody titers, hematocrit, and hemoglobin, or a complete blood count. Ultrasound and or amniocentesis may be performed if certain fetal abnormalities are suspected, also called antenatal care, prenatal care. See also antepartal care, postpartal care. Antepartum hemorrhage. Greek ante before Latin parterior, to have labor pains. Greek hema, blood, rhynia, to burst forth, bleeding from the uterus during a pregnancy in which the placenta appears to be normally situated, particularly after the 28th week. Antipyretic. Latin ante before, Greek pyretos, fever, before the onset of fever, also called antifebrile. Anterior a, the front of a structure. 2, pertaining to a surface or part situated toward the front or facing forward. Compare posterior, see also ventral. Anterior. 1, the front of a structure. 2, pertaining to a surface or part situated toward the front or facing forward. Compare posterior, see also ventral. Anterior Achilles bursitis, see Albert's disease. Anterior asynclitism, see asynclitism. Anterior atlantoaxial ligament, 1 of 5 ligaments connecting the atlas to the axis. It is fixed to the inferior border of the anterior arch of the atlas and to the ventral surface of the body of the axis. Compare posterior atlantoaxial ligament, anterior atlanto-occipital membrane, 1 of 2 broad, densely woven fibrous sheets that form part of the atlanto-occipital joint between the atlas and the occipital bone, also called anterior atlanto-occipital ligament. Compare posterior atlanto-occipital membrane. Anterior axillary line, AAL, an imaginary vertical line on the body wall continuing the line of the anterior axillary fold with the upper arm. Anterior cardiac vein, 1 of several small vessels that return deoxygenated blood from the ventral portion of the myocardium of the right ventricle to the right atrium. See also coronary sinus. Anterior central gyrus, see precentral gyrus. Anterior cerebral commissure, Latin ante plus prior, foremost, cerebrum, brain, commissura, adjoining. A bundle of fibers in the anterior wall of the forebrain connecting the olfactory bulb and cortex on one side and the similar structures on the other side. Anterior chamber, Latin ante plus prior, foremost, Greek chimera, an arched cover. the part of the anterior cavity of the eye in front of the iris that contains the aqueous humor. Anterior common ligament. See anterior longitudinal ligament. Anterior crural nerve. See femoral nerve. Anterior cutaneous nerve. One of a pair of cutaneous branches of the cervical plexus. It arises from the second and the third cervical nerves and divided into the ascending and descending branches. The ascending branches are distributed to the cranial and ventral and the lateral parts of the neck. The descending branches are distributed to the skin and the ventral and lateral parts of the neck as far down as the sternum. Anterior determinants of cusp. In dentistry, the characteristics of the anterior teeth that determine the cusp elevations in the fossa depression and restoration of the post-canine teeth. Such determinants include occlusion, alignment, overlaps, and the capacity to disocclude conjointly with the condylar trajectories. Anterior drawer signer test, a test for rupture of the anterior cruciate ligament. The result is positive if there is increased anterior glide of the tibia when the knee is flexed at a 90-degree angle. See also drawer sign. Anterior elastic lumina. See Bowman's lumina. Anterior fontanelle, a diamond-shaped area between the frontal and the two parietal bones just above an infant's forehead at the junction of the coronal and the sagittal sutures. See also fontanelle. Anterior guide in dentistry, the portion of the articulator that is contacted by the incisal guide pin to maintain the selected separation of the upper and lower membranes of the articulator. The guide influences the changing relationships of mounted cast in eccentric movements. Compare condylar guide and sessile guide. Anterior horn cell, a large nerve cell, the body of a motor neuron in the anterior column of the spinal cord. Anterior horn of the spinal cord. Latin ante plus prior, foremost, cornu, horn, spina, spine, Greek, cord, string. One of the horn-like projections of gray matter into the white matter of the spinal cord. The anterior or ventral horn contains efferent fibers innervating skeletal muscle tissue. Anterior longitudinal ligaments, the broad, strong ligaments attached to the ventral surface of the vertebral bodies. It extends from the occipital bone and the anterior tubercle of the atlas of the sacrum, also called anterior common ligament. Compare posterior longitudinal ligament. Anterior mediastinal node, a node in one of the three groups of thoracic visceral nodes of the lymphatic system that drains lymph from the nodes of the thymus, the pericardium, and the sternum. The nodes are located ventral of the brachiocephalic veins into the arterial trunks from the aortic arch. Compare a posterior mediastinal node. See also lymphatic system, lymph node. Anterior mediastinum, a caudal portion of the mediastinum of the middle of the thorax, bounded ventrally by the body of the sternum and the parts of the fourth through the seventh ribs and dorsally by the parietal pericardium extending downward as far as the diaphragm. Compare middle mediastinum, posterior mediastinum, superior mediastinum. Anterior nares, the end of the nostrils that open anteriorly into the nasal cavity and allow the inhalation and the exhalation of air. Each is an oval opening that measures about 1.5 centimeters anterior-posteriorly and about 1 centimeter in diameter. The anterior nares connect with the nasal fossa, also called nostrils. Compare posterior nares. Posterior neural pore, the opening of the embryonic neural tube in the anterior portion of the forebrain. Compared posterior neural pore. See also horizon. Anterior pituitary. See adenohypophysis